You're Namaskar. You're watching Dr. KK Med Talks Fridays with Dr. Anita Kant non-stop 1056th episode. Let's have the headlines of the day. Iron deficiency anemia is linked to fatigue, brain fog, focus issues in adolescent girls and young women, says research. A 2023 study published in the Journal of American Medical Association reveals that nearly 49% of females aged between 12 to 21 are iron deficient. Over 80% of women are iron deficient by the third trimester of pregnancy. MCure launches initiative to help women assess anemia risk with self-test. Ayush will conduct a placebo-controlled double-blind trial of Ayush drugs to study their efficacy in treating anemia in women who are not pregnant. Let's go to the topic of the day. So today we will be talking about iron deficiency, its causes, symptoms and solution for women. और इस बारे में हमें बताने के लिए आज हमारे साथ हैं डॉक्टर सुषमा पंपनवार. Dr. Sushma is a skilled obstetrician, gynecologist and infertility specialist at Iswarya Fertility Center and Isha Hospital in Yelahanka, Bangalore. With an MBBS, DGO and DNB in obstetrics and gynecology, along with advanced training in gynecological endoscopy and reproductive medicine from Kiel University, Germany, Dr. Pampanavar brings a wealth of expertise to her practice. Her commitment to reproductive health and fertility solutions has made her a trusted name in helping couples achieve their family goals, utilizing state-of-the-art techniques in gynecological and fertility care. Now we will start asking her questions, which have been forwarded to us by so many listeners and viewers. So, shall we start, ma'am?
Yes, ma'am. Thank you for the introduction. We'll start.
So, what exactly is iron deficiency and why are women more prone to it?
So, as such, anemia, it is not just the reduction in the hemoglobin. It is actually the decrease in the oxygen carrying capacity of the blood because of reduction in the hemoglobin. Iron is one of a content of hemoglobin, hence, which is the most common cause being the iron deficiency anemia. So, why women are more prone? As such, women do have the menstruation, which is the most common cause when compared to males. Women are more prone for anemia. This is one thing. Second thing is probably nutritional deficiency, though it can be compared to males also. Gender bias in India compared to males would be a cause in India as such specifically. And other than that, the other causes of anemia which equally works even for males as well, like reduced absorption of iron, decreased intake, which are the common causes. But specifically why anemia, iron deficiency anemia as such is common in women is probably because of their menstruation, wherein they lose their blood, and others specifically which I already told, the gender bias.
So, how can I tell? This is a question from a lady. How can I tell if I might have iron deficiency? What are the warning signs?
So, iron deficiency, in the sense, it is nothing. A woman can be just compensated, though she is having iron deficiency. It is not that all women with iron deficiency should have the warning symptoms. They might be just aram se compensated. Other than that, some of the warning symptoms which we usually come across, wherein the ladies who come with symptoms such as fatigue, weakness, dizziness, some and even mood changes, loss, reduced interest in their working capacity, and major at a severe forms, they have even dyspnea, palpitations. and still more severe anemia forms can even present with edema of the ankles. And when these are the warning symptoms wherein a lady comes to us, and once we examine, we take it forward by just looking at the clinical examination and then doing the investigations.
Okay. So, these primary causes of iron deficiency in women, you have told us. So, are these some of these causes preventable in women?
Of course, most of the, not only few causes, most of the causes are preventable. The first thing itself is the low iron intake. So once the iron intake is good enough, it can be prevented, the iron deficiency, and reduced absorption, which I was already telling you. Changes in their lifestyle, changes in the lifestyle habits, like cooking food in the utensils or iron utensils, and others which we will take the forward, such as intake of vitamin C, that is adding a spoon of lemon, and reduced intake of tea and coffee along with the diet. All these are preventable causes wherein the iron deficiency itself can be prevented.
So, can this iron deficiency be treated by, getting a richer diet alone, or other factors are also involved?
So, iron deficiency anemia, as already discussed, uh, iron rich diet has to be taken so that it can be corrected. Along with that, which I was already telling you, the reduced absorption, the factors which affect that reduced absorption can be prevented. We will take this forward if any questions are there. And those who are with already with the poor reserve of iron, though those people have to be identified, and those have to can be treated. Along with that, as such, during pregnancy there is increased nutritional demand during pregnancy, as such, if we specifically come to it. So gapping of pregnancies, like how we usually tell, at least 2 years, that is 24 months, that is 2 years of gap preferably. All these can be prevented. All these can be prevented as to prevent the iron deficiency anemia as such.
Right. So, you said heavy menstruation also leads to anemia and iron deficiency anemia in women. So, how does it cause iron deficiency anemia?
So, once a lady loses, as such, ladies do have menstruation. Not all ladies will be anemic. So, the thing is, a lady should identify how severe the bleeding is to tell it as iron deficiency anemia. Whether the bleeding, the history of passage of clots in the menstrual cycle, which we call it as menorrhagia, itself is one of an indicator that she is having excessive blood loss. So this is the thing. Passage of minimal clots, how many pads does she change? So, depending upon this history, we can come to a conclusion, yes, the lady is having excessive blood flow, and this can be treated. And we can identify the cause, and we can treat the iron deficiency anemia. Menses alone, when we consider.
Mhm. Right. So, in pregnancy, why iron levels only fall down? There are other things also. Why only iron deficiency anemia precipitates?
See, most common cause as such, nutritional anemia. First thing. Second thing is, during pregnancy, if I do a hemoglobin, as such, there is physiological anemia during pregnancy because of hemodilution. This is normal because during pregnancy, the plasma volume, the water content in the body increases. That is, the plasma volume increases, which causes the less in hemoglobin. So why only iron deficiency? Because it is the most common cause. Mostly, probably the nutritional cause. Other than that, the poor reserve itself. She herself is already the reserve is poor, and she has entered her pregnancy, and this again causes the most common cause being the iron deficiency anemia. Along with that, the reduced absorption. She doesn't feel like eating. And all these accounts for iron deficiency anemia, especially during pregnancy, commonly during pregnancy.
So, why anemia is only due to iron deficiency, or are there any other reasons also associated with as causes of anemia?
It is not just the, as already told, it is not just once I check the hemoglobin, yes, it is less. It doesn't mean that the lady is suffering from iron deficiency anemia alone. It could be many other causes. So it depends upon what type of anemia she is. Most common cause is iron deficiency anemia, 90%. Other than that, vitamin B12 deficiency, folic acid deficiency, which we call it as megaloblastic anemia, or dimorphic anemia, means combination of vitamin B12 as well as folic acid. Other than that, excessive blood loss itself, hemorrhagic anemia is what we call. Other than that, aplastic anemia, thalassemias, genetic causes of anemia. All these are the other common causes of anemia. It is not just the iron deficiency. That is just the major cause of anemia during pregnancy.
So, can this iron deficiency affect the mental health, causing symptoms like mood swings or difficulty in concentrating in work or housework for that matter?
Yes, as already told, it is one of a symptom, mood swings, reduced working capacity. So, why this happens is, uh, anemia, when we call it, is the reduction in the oxygen carrying capacity of the blood. So, once there is reduced iron causing reduced reduced hemoglobin causing reduced oxygen carrying capacity of the blood to the brain. So mood changes, mood swings, depression, all these we relate it.
Okay. So, what are the tests that are typically involved in diagnosing iron deficiency anemia?
So, one, just by the symptoms itself, which I already discussed. Coming to the signs. So, once a lady comes to us with all the symptoms which I have already told, we examine her just by looking at her skin and the mucous membranes, which we call it as the lower palpebral conjunctiva. The pallor, the paleness of it, the palmar creases becomes very prominent. Along with that, she might be suffering from angular stomatitis and cheilitis, around the angular cheilitis. And once we examine her palms and her nails will be brittle, which we call it as koilonychia. These are, of course, the severe forms, and the paleness of these nails. All these goes in favor of anemia. Of course, we cannot tell what type of anemia. So once we conclude that on examination that this is anemia, we jump forward to ahead with the investigations. Why do we want to investigate is to diagnose, to prove our diagnosis that this is anemia, then to know what type of anemia so that we can specifically treat it. So in that way, we go ahead with hemoglobin testing, that is most commonly by the Sally's method. And not only that, nowadays automatic machines have come, and once we put and we run the machine, it itself will give the complete hemoglobin, the hemogram, what we call, or the CBC is what we commonly use, complete blood count. Then once we diagnose the type of the anemia, what anemia it is, here we even concentrate the degree of anemia, in the sense how much is our hemoglobin. Anemia less than, in anemia definition as such, we all know less than 12. Of course, is it less than 7 to tell it as severe anemia, 7 to 10, 10 to 11, so that. So we do this Sally's method to diagnose and to know the degree of anemia. After, once we know this anemia, we go ahead with the peripheral smear. Peripheral smear, why do we want to do it is to see what type of anemia it is, wherein we see, once we do the peripheral smear, we see the morphology of the red blood cells. The red blood cells as such, in iron deficiency anemia, they will be small, microcytic hypochromic anemia is what we call. There is a change in the size and shape of red blood cells. The reticulocyte counts could be slightly high. All these features of in the peripheral smear goes in favor of iron deficiency anemia. If at all the red blood cells appear to be big, macrocytic, those that goes in favor of megaloblastic anemia. So this peripheral smear will tell us to know what type of anemia it is. Once we see a microcytic hypochromic anemia, we next go ahead with the hematological indices, that is MCV, MCH, MCHC. So once we know these indices are increased, we go ahead with specifically testing. If at all, if I really want to test what type of anemia it is, I just move ahead to test for TIBC, that is total iron binding capacity, serum ferritin levels, serum iron to TIBC ratio VC, or else just a vitamin B12 levels also we can see to label a lady as megaloblastic anemia. So all these, along with these are, if at all, if I still I want to go ahead, if I'm still not able to make the diagnosis, bone marrow aspiration, bone marrow examination also will tell us to, especially if we are diagnosing aplastic anemias and some of the refractory anemias, which is not at all, we are not able to treat in spite of giving the iron supplements, but still our hemoglobin is on the lower side. So we may need to take a further decision to go ahead with bone marrow aspiration also.
Okay.
These are
So
the
how
specific investigations.
for iron? Yes, right. So how much iron does a woman require daily, and does its amount change with age or her health conditions like pregnancy?
So, as such, 60 milligram is what is recommended. And during pregnancy, each pregnancy needs about 1000 mg of iron. And of course, it depends upon the adolescent age group and the reproductive age group
Because their menstruation is happening.
happening, and age wise also.
Okay, right. So, which iron supplements are best for women, and are there any side effects of these iron supplements?
As such, iron supplements come in the form of tablets, the syrups, and the injectable forms. So we treat depending upon the severity of the anemia. Mild to moderate, we just put them on oral iron tablets. And if the lady is intolerant to the iron oral tablets, we try to put them on the syrup form. Of course, it has its own side effects like staining of the teeth, though it is tolerated well. And if it is very severe, not severe, the moderate forms, we go ahead with injectable forms of iron, and very severe, we need to put them on blood transfusion. And the next question which you asked, madam, yeah, this thing, serious side effects which you were asking. As
Yes.
such, iron supplements are very any either it is the pregnant or non-pregnant, it is the most common side effect is the intolerance for the this thing. It can be divided as upper GI side effects and the lower GI side effects. Upper GI side effects like staining of the teeth, metallic taste in the mouth, or gastritis, severe form of gastritis, and vomiting can happen. Lower GI side effects such as diarrhea, constipation, black stools, these are the side effects. And as such,
So,
injectable forms usually are very tolerated, though they have a mild risk of anaphylactic reactions. But nowadays, technology and things have been improved, and we have very rarely seen anaphylactic reactions with injectable ions.
so what are the top iron-rich foods that women can include in their diet to prevent deficiency?
It depends upon the lady whether she is a vegetarian diet or a non-vegetarian diet. Vegetarian diet, we all know green leafy vegetables is very rich in iron, like palak, that is called spinach, methi, or fenugreek, and that. And others such as cereals, such as wheat, bajra, jawar, pulses such as all the green peas, groundnuts, and jaggery is rich in iron, ragi is rich in iron. We South Indians have lot of ragi, which is very rich in iron. And fruits such as apple, bananas, of course they are medium containing medium iron content, which they have. And non-vegetarian diets such as liver, meat, and even egg and fish are moderate source of iron.
Okay. So, can combining iron-rich foods with vitamin C really improve iron absorption?
Yes, vitamin C has is nothing but ascorbic acid. So it is told that vitamin C increases the iron absorption in the food. So we usually recommend those who are diagnosed with iron or as such in their routine practices, better to take half lemon, include the lemon in their meals during food while having their lunch
So,
or dinner.
you did mention that tea or coffee can reduce the absorption of iron. Besides this, are there any other foods or drinks which can decrease the absorption, or maybe some other routine medicines that a woman may be taking which will decrease the absorption?
Yes, some of the vegetables which are known to have oxalate contents of some of the vegetables, or some of the phytates containing cereals, phytates and tannins, of course, we tell it in tea and coffee. Along with that, phytate which are known to be present in some cereals, or egg yolk itself, egg yolk which has phosphates in it can reduce the iron absorption. And coming to few of the drugs such as alpha dopa, levodopa, ciprofloxacin could reduce the iron absorption medicines.
And if can it be given together with calcium, because these two are prescribed commonly in pregnant women?
No, the iron and calcium, preferably iron chelates the iron. Calcium chelates the iron content which is taken. So, preferably, we ask the ladies, especially during pregnancy, we ask them to take it at a different time, iron in the morning or calcium in the night. This is how we usually recommend.
Okay. So, once iron supplements are started for a woman, how soon can a woman expect to feel better?
Usually, it is told that 1 gram per deciliter of hemoglobin increases by 1 week. Initially, it starts with the reticulocyte count increase, and this is what 1 to 2 weeks we can expect to see the hemoglobin rise as well as their bodily changes. They feel enthusiastic in their working activities and all that.
Okay. So, what are the risk of not treating iron deficiency for women, both in short and long term?
Short term, of course, iron deficiency is not a life threatening condition, is what we know. Short term, it affects their life day to day routine activities. This is what I would tell. And iron deficiency, especially during pregnancy, has its own risks, especially for the mother and the baby also. That is second. That is again the secondary topic. When we speak about iron deficiency, as such in non-pregnant women, short term, this is what the routine, her day-to-day activities and all will be hampered. Long term, it is just about how she takes it forward. And I already told some women will be already compensated for it, and it doesn't even present.
Right.
They just
So,
be like, and this is about just the specifically iron deficiency. Of course, it is about, if it is about thalassemia, aplastic anemia, they have their own long term side effects.
okay. Right. So, can this iron deficiency lead to physical changes such as, you have told us about brittle nails, but women are very particular about hair loss and their skin looking pale. Can these be precipitated due to iron deficiency?
As such, hair loss relating to iron deficiency, I have no idea, madam. So how relatively what the studies tell, we need to just go about it. And other than that, no other physical paleness and all could have been there. Otherwise, I don't think hair loss is specifically nutritional. See, iron deficiency as such, I don't think it causes hair loss, but associated usually nutrition, when it comes, it is not just the iron which is deficient. Other causes such as folic acid, that would have been causing the hair loss, I agree. But specifically iron loss is what the studies tell, I'm not clear in it. Probably it may
Okay.
not also.
Okay. Is it possible to take too much iron, and what are the risks of iron overload?
Anything in excess is not good, we all know. And excessive iron, what it of course, bit of iron in too much losses, it is excreted if it is not useful. Too much of iron goes and collects in all the organs, Hematochromasis is what we call, causing the liver damage and all that. Sometimes intestinal perforations, constipations, which causes again secondary symptoms such as piles and all that it causes. And treatment, you asked, madam?
Yes.
Ha.
Yes.
Treatment wise, identify the cause. If it is too much, try to reduce it. Reduce the dosage of iron supplements once we know her hemoglobin has come to normal levels. Or if it is too high, or if iron poisoning, what we call, the lady has taken too much of iron, instead of taking one tablet, she has consumed more. Chelation therapy is what we call. That can be dexferoxamine is what we call the anti-chelating, anti-iron, that is chelating agent. This can be given. Stomach wash can be given.
Okay. So, how can a woman at risk, like those with heavy periods or pregnant women, monitor and manage their iron levels effectively?
Monitoring once, preferably we can't just wait for the warning symptoms to appear. It's better they just get their hemoglobin tested. And based upon the hemoglobin levels, we can take this forward as already discussed, to see what type of anemia by doing a peripheral smear. And if it is really turns out to be a microcytic hypochromic anemia on peripheral smear, do the iron studies. And if it is macrocytic, the RBCs are appearing big, go test for vitamin B12 levels and treat it. So it is better, the pregnant women or the ladies as such, it is better not to wait for the warning symptoms. If they have symptoms like excessive blood flow and pregnancy, if at all, if it comes, the time gap between two pregnancies is less, monitor the levels. That is why we as such, government of India recommends, whenever the lady comes to us at her first visit, check her hemoglobin. This is how we monitor and keep her and take it further depending upon the degree of anemia what it is.
So, any practical lifestyle changes which can prevent this iron deficiency?
Good nutritious diet is what which I already told. Our old traditions such as cooking in iron utensils, good nutritional diet, are some of the which we usually advise for all the ladies. And empirically we can just hookworm infestations, if at all the area is endemic for malaria, empirically chloroquine tablets can be given. These are some of the changes which we can do it.
So, finally, I'd like to ask any takeaway message for our listeners.
Takeaway message, as such iron, as such anemia during pregnancy, as such anemia is very common in females. uh, Keep a watch on your hemoglobin. Don't wait for the symptoms to warning symptoms to appear. Keep a watch on the hemoglobin just by your symptoms as such. Excessive blood flow and feeling loss of fatigue and all this, check your hemoglobin. Meet your gynecologist, let them check your at least rule out the gynecological cause, which is the most common cause in women, menstruation. If anything, that can be addressed. This is what I would like to tell, madam.
Thank you. Thank you, Dr. Sushma Pampanavar, for joining us today. Could you show us the certificate, please? This is a small token of our thanks for joining us today.
Thank
So
you.
that will be all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Namaste, madam. Thank you.